Hello, I'm Dr. Andy John, one of the GPs at Haresfield and Kempsey Surgeries. On behalf of the team, I wanted to say that we hope you are all okay and staying safe during these ongoing difficult times. As you'll be aware, we are delighted to support the continued rollout of the COVID vaccination for our most vulnerable groups. However, we all know that in spite of this, now is not the time to drop our guard, and I would urge you to continue to wear a mask, wash your hands frequently, keep your distance, and observe the lockdown measures until advised otherwise. Our surgery remains open for you, but we are asking that you do not walk in and instead pick up the phone or complete an online form first. So that is why I've recorded this message, to explain to you about the new online contacting service that is available for all patients. This can be used for any query and is very straightforward to use. I will talk you through how to use this in a moment on the screen. These forms, which we call online triage forms, are reviewed by a clinician at regular intervals every weekday and are then directed to the right team to help you with your query or presenting problem. We aim to process all forms within 2 working days, and we will then get back in touch with you either over the phone or by text to confirm what the practice will do to help. We hope this option will help patients as it can be accessed 24/7. And you do not have to phone the practice to be able to get in touch. For those patients without access to the internet or who feel that they struggle to complete the online forms, we would still encourage you to call the practice so that our reception staff can help you with your query. I will now show you how this looks and how to use this on the Patient Access app. Log into the app with Patient Access login details. The reception team can help set this up, but you'll require the email registration process to be completed if you have not already. It is worth noting that the appointment function is currently not in use, but we hope to activate this at some point in the future. The app takes you to the main home page. Here you can see all the services the app can assist with. Patient Access has its own support centre, which you can see here at the bottom. Use this if you need to reset your details or have any general queries about how the app works. For the online triage forms, you need to click the 3 dots at the bottom right where the More button is. Then click on the Health Advice tab. Here is the main list of several symptoms and queries that you may want to contact us about. If your problem or question is not specified as an option, then there is the general options at the top that you can use to contact us by. The search bar at the top will jump to topics that are relevant to your word that is typed. We have searched for headache as an example to show you on this video. Once you select the symptom or topic, then it shows you the resources available for this. The first option here was to the patient information leaflet about headaches in general. There are also videos with doctors talking through helpful advice in more detail.
Migraines are miserable and they have dozens of triggers, but those triggers tend to be personal and different between different people. So the first thing I suggest you do is to keep a diary.
If you still feel you need to contact the practice, then there is an option to do this. There are some important factors to remember before doing this. Read through the bullet points on the Before You Start screen. With this option, there are several pages that need to be completed in order for us to get the relevant information about your symptoms or queries. These questions have been designed by the GPs involved with the development of the Patient Access app. Consent and T's and C's have to be agreed first. Here, a general advice page opens initially, directing you to leaflets or a video. You then have to work through the form selecting the relevant option that applies to you. Sometimes when selecting a particular answer, a pop-up message comes up on the screen. This is what we call safety netting advice. It is important that you read this and the actions required are carried out if this applies to you. Some of the form might require you to enter data and information by typing this into the correct field. You'll have to complete a satisfaction questionnaire for the use of the app. The final thing to do is enter additional contact or personal information so we can identify you, and make sure that you review the form and press submit. This is then completed and is sent electronically into our EMIS system. For those of you that do not have the app, you can also access the online forms via our website as demonstrated in this video. Just click on the blue Online Consult logo as shown to type in the relevant word or search for the condition. We hope that you are able to give this a try next time you need to contact the practice. Looking forward, the reception team might ask patients to start completing this form when making contact with the surgery. The information that you input on these forms will really help me and the other clinicians working here to support your care. There's more information about this all on our website. Take care, stay safe, and goodbye for now.